Morning, everyone. Welcome back to day 2 of our Business Solves conference. We're so glad that you're here. For those of you who didn't attend yesterday, I'm Mark DeCourcy, the Senior Vice President of the Chamber Foundation, and I lead the corporate citizenship for the Chamber. We had an awards program yesterday. We gave out 8 awards. Congratulations to all of our winners for our 23rd year. It's really an honor to share their work and your work up here on the stage, and I just want to remind everyone why we're here. Right? I mean, we want to make sure that you're informed about what's going on, the opportunities to collaborate. We want to inspire you to act, And we want to ignite that collaboration, right, amongst all of you for greater impact on all the issues that we work with and on. So I'm excited to kick off our first panel here. It's on the importance of kindness and well-being in business and why it matters. It's not just a nice thing to do, it's not the right thing to do only, but it's good for business, and we're going to get into why. Following that panel, we're going to talk about hidden disabilities, and we'll get more into that as well. And then, of course, we'll talk a little bit more about health, and we'll talk about our breakout sessions, and we have field trips this afternoon for those who'd like to go. It's nothing like getting out of this room and getting into places where the real action is happening. If you have any questions about those field trips, see one of our staff. We can try to plug you in. It's not too late. So with that, let's get going. So our first panelist, Mohammed Yunus, he is the editor-in-chief at Gallup. He'll be joined by Misty Gaither, the Vice President of Diversity, Equity, Inclusion, and Belonging at Indeed. And of course, we have Patty Riddlebarger from Entergy as well. They're going to talk about the importance of employee well-being. It's a topic that is important to all of us. But to start this off, Mohammed's going to come up here by himself, and he's got some insights to share about how Gallup measures the data and what well-being means to them and how and what is important, he thinks, for you to understand. So, Mohammed, why don't you come on up and we'll get this thing started.
Good morning, Washington, D.C. It's great to be here. I went to the wrong building this morning, and now I'm here with you just in time, so thank you for your patience. We live in a world of numbers. Everything in our world fundamentally comes from counting transactions, trees in a forest, CO2 emissions, presidential election outcomes. All around us, people are keeping track of how the world is developing. One of the things that struck us back in 2005 was that despite all of these numbers and tracking, few people were actually definitively reporting how people's lives were going from citizens themselves. When we started this work, a lot of people were very skeptical and were wondering why an organization like Gallup that's focused on economics, politics, society, why we would care about well-being. And we really felt that there was a story that wasn't being told with classic metrics. And that was really the motivation for the Gallup World Poll. The map you see in front of you represents everywhere in the world we've been consistently tracking how people are living their lives since 2006. And it wasn't easy. We've been spending the past several years going east, south, in every direction we can to try to come up with a way to enable, to empower citizens to speak up for themselves about how they were living their lives. And when I say it wasn't easy, it really wasn't easy. This is a sampling frame map from our polls in Nigeria. And every dot you see is essentially a unit within which we conduct our surveys. We build these units based on population density, based on demographic information in the country. We do this in every country that we've been tracking since 2005. And here's what we found, that even though we live in a world of numbers, some of the numbers that aren't really being focused on can actually tell us the most about what's happening in a society. I'm originally from Egypt, and I joined Gallup in 2008 to focus on the Middle East, try to understand how young people were experiencing their lives in that part of the world through asking them questions. One of the most fascinating findings we looked at as the Arab Spring ended was to go back to our data sets and try to understand, was there anything in the countries that saw unrest that would have been an indicator or a sign to leaders that something was not right? What we found is that even though GDP per capita was rising at a pretty healthy rate in Egypt, people's own life evaluation actually was crashing. So the green line that you see is a numeric estimate of how people evaluate their own lives. Some people call it well-being. We measure well-being in a lot of different ways. Life evaluation for us is simply asking people on a scale from 0 to 10, and you can think about this for yourself now. Imagine where your life is today on that scale, if 10 was the best life you could imagine and 0 was the worst life. And where do you expect your life to be in the next 5 years on that scale? We ask that question in local languages, through local people all over the world. What we found in Egypt was that thriving, how people were actually evaluating their own lives, was crashing at a time when GDP per capita and a lot of other classic metrics looked like they were doing pretty healthy, pretty good. We saw the same thing in a few other countries in the region at the same time. Tunisia, Syria, Bahrain, and a couple others I won't mention because the difference wasn't that drastic. But basically what we saw across the countries that experienced unrest in the Middle East around 2011 to 2012 were the countries where life evaluation was actually tanking. Many of these countries, Egypt and Tunisia in particular, were receiving awards from the World Bank, the World Economic Forum, and others, rightfully so, for privatization efforts, for a lot of macroeconomic reforms that were presented as really critical to state stability to these nations. So they did their homework to some degree on the economics, but nobody was tracking how people actually lived their lives. So that's a really interesting story about the Middle East. What we found is that actually this has been happening in a lot of places. This is the United Kingdom before the Brexit vote. You'll see it's a very similar trajectory. This was also true in Ukraine before the Euromaidan revolution. It was also true here in the US before the election of Donald Trump. So as our researchers were going through these data sets, trying to look back on situations of unrest or perhaps just an unexpected political outcome to try to understand how were people evaluating their lives in those countries where we saw these changes. After 5 million interviews across the world, we've come to one of the reasons why this has been happening. Another thing we mention, in addition to life evaluation, is experiential well-being. So we ask people, we've now asked over 5 million people across the world, have they experienced a lot of anger, stress, worry, physical pain, or sadness in the day before we did the interview? What you're about to see is a trend of the entire world on those several metrics built into an index score. And it tells a pretty clear story. There has been a consistent rise in worry, stress, anger, physical pain, and sadness across the world. The billions of people that this metric represents don't necessarily have the lowest income in the world. They don't necessarily live in the poorest countries. They don't necessarily live in societies that are very free or very not free. This is something totally different. This is about understanding the world through the voice of individuals, through the actual experts, the only experts that really exist on how their life is going. But you might ask yourself, why? Why are people's experiences heading in this direction? The why is really captured in this slide. The same life evaluation metrics that we've been asking people on a scale from 0 to 10 today in the next 5 years helped us find something across the world that was actually more pernicious than income inequality. It's actually well-being inequality. And what you're looking at here are the folks in the top 20% of life evaluation metrics in the world and the folks at the very bottom. What we've learned is that people who are living a great life have never rated it higher than they are today. But people who are not living a great life have never rated it more poorly than they are today. Why? our research really uncovered 5 critical facts about what makes a great life based on this work across the world. And you'll notice that some of these will sound really relevant to us. Some of them may not sound as relevant, but I want you to imagine people in very different political, economic, income situations assessing their lives on these metrics. The people at the top 20% are fulfilled by the work they do. They have little financial stress. They live in great communities. They have good physical health. And they have ones they can rely on for help when they need it. If you just think about those 5 dimensions of a life, you can be insanely wealthy or just making it by and check the box on all those things. The people at the bottom of the scale, the bottom 20%, they're people who don't have a quality job. Their income is not enough for them to get by on the life that they're trying to live. They live in broken communities. They're hungry or malnourished. And they don't have anyone in their life that they can count on for help. To transition now to our panel and to talk about why this matters to workplaces, it's really important to understand that this research has already proven that money does not buy happiness. Actually, there's a certain limit beyond which people don't evaluate their lives much better if they're getting paid more. It actually just kind of flattens out. And in the US, it's about 75,000K pre-inflation. But while money does not buy happiness, it's really hard to be happy without it, at least to be able to cover your basic needs. One of the most important factors of well-being is work well-being, which has nothing to do with how much you make. It has to do with how you feel about what you do for a living, how you feel about the people you work with, how you feel about the mission and purpose of the organization you are serving. Throughout all of our well-being research, we found that people's attitudes, perceptions of their work are one of the most important factors in how we evaluate our lives on that scale from 0 to 10, whether it's here in the United States or it's in Egypt, where I came from. There is a huge jobs crisis in the United States and in the world, and it's not unemployment. That line used to make a lot more sense when unemployment was high. But there is a huge job crisis in the lack of quality jobs. Having a job doesn't really tell us anything because it's a box that's checked to count the numbers, but it has nothing to do with how people feel about the work that they're doing. 12 billion workdays are lost annually due to depression and anxiety. I can go on, but if you've ever led a team, you get it. You understand that how people feel about the work they do is absolutely essential to how they perform. And the research, our research for decades has shown that it's absolutely essential to the bottom line of your business. With that, I want to welcome my 2 fellow panelists up to the stage. Oops, that's the wrong button. Perfect. All right. Perfect. I love this music.
Yeah, what kind of music?
All right. Misty Gaither is head of diversity, inclusion, and belonging at Indeed. Misty, welcome.
Thank you.
Patty Rillberger is VP of Corporate Social Responsibility at Entergy. Welcome.
Good morning.
You both are ladies that really walk the walk and live everything I just presented from a lot of different perspectives. Misty, I want to speak to you about a project you all have been involved in with Born This Way Foundation. The Kindness in the Workplace report was fascinating for me to read through. I'd love for you to just take us through some of the findings from that report.
Sure. Good morning. My name is Misty Gaither. My pronouns are she and her. And so Indeed actually commissioned or partnered with the Born This Way Foundation for the report. And what we found in that report is that, you know, kindness and workplace well-being and mental health are the priority for what we call young workers. So when I say young, I'm not calling anyone old. I actually don't fall into that categorization myself. but it's focused on the population of 18 to 29-year-olds. And so they are really, really looking at companies to determine how we're prioritizing kindness and well-being in our workplaces. And so when we think about the topic of, talent retention and what we've coined as either the great resignation or the great realization, it's really giving us an opportunity to lean in on how we actually create inclusive environments where people can truly thrive. So I'll just share a couple of statistics. And so, when we surveyed the Gen Z and young millennials, about 89% of them see mental health and kindness as high priorities in the workplace. And when we think about creating a workplace that can help you all recruit and retain your employee base, about 80% of respondents were more likely to apply for a job where it listed kindness or some company value that alluded to a sense of inclusion or a sense of belonging. And then lastly, young people want pay that is stronger and benefits that are more equitable. And when we did this survey, we were intentional in the audience. And so it was really thoughtful around the Black, Indigenous, people of color community, as well as the LGBTQ plus community. And those two segments of the population tend to actually work multiple jobs. And so that's why they're really evaluating companies to see if it's a good quality job.
Awesome. Patty, I'd love for you to react to that, but also to tell us a little bit about the culture you all have developed at Entergy as it relates to this topic.
Well, really interesting to hear your research and your results, and inspired by it as well, because at Entergy, diversity, inclusion, and belonging is one of our core values. So I was really happy to hear what you had to share about the importance of that, not just for millennials, but for all workers. So our goal at Entergy is to become the premier utility. And we know that the only way that we can do that is if each and every one of the 13,000 men and women who work at our company feel empowered to bring their full authentic selves to the workplace every single day. And that's where diversity, inclusion, and belonging is key. And so we work to to foster that culture at our company. And it might help a little bit to define the terms. And the way that we define those terms is diversity is being invited to the party. Inclusion is being asked to dance. But belonging is when they're playing your jam. And so really we want people to feel that sense of belonging. And that comes down to building trust and caring among the individuals on your team. And so we work to foster all of those values at our company, not only internally, but also externally with some of the community organizations that we work with. And I'll talk a little bit about one group. The Anti-Defamation League has a phenomenal program called No Place for Hate. And it's a program K through 12 schools. And it's designed to help school leaders foster cultures of inclusivity and diversity among on their school campus. And these days, I think it's more important than ever. I think 1 in 4 students reports feeling bullied at school. Wow. And part of that stems from children not understanding differences, not having tools to deal with those differences. And the No Place for Hate program does that. And it's through our partnership with the ADL, it's been about 13 years, we've been able to provide the program free of charge to schools across Arkansas, Louisiana, and Mississippi. And we feel that it's important to instill these values in children because they are our future workforce. And so much the better when our employees come to us with those values already instilled. So,
Missy, I wanted to ask you, it is a world unlike the world before with hybrid. Belonging, inclusion, diversity, connecting, development opportunities, all of these things have been known and studied and discussed and acted on for generations. But 2 years ago, 3 years ago now, our whole world has changed in terms of where we work and how we work. How has hybrid impacted some of these efforts? How has it enabled some of these efforts at creating a more kind and inclusive workplace?
So I think working in a remote or virtual or hybrid environment has helped because we are now seeing inside of each other's homes. I think we've been able to see people for who they are and not just what they do at the company. And at all levels of our organization, we've really seen the imperfections, right? From the CEO down to your entry-level employee. We've heard the dogs barking, we hear the children crying, some people have made cameos, and so we've really had to rethink, how we work with each other. And I think what that's dialed up is a level of compassion and empathy and vulnerability. And so my hope is that as we really start to talk about return to office and we think about the future of work in this new environment, that we don't lose all of those elements that have really strengthened the relationships. And so I think it's also ensured that we are supporting people from a mental health perspective. If you think about before the pandemic and someone's like, hey, how are you? You're like, I'm fine, I'm good. And you just keep going. And then now somebody's like, how are you? You're like, actually, not having the best day. And so I think what has happened, and what I like to say is, as a leader, we're responsible for being open and authentic because that gives our teams permission to do the same. And so we've been able to problem solve and actually maybe even reallocate work as a result of just understanding the impact of all of these world events on everyone at our companies in ways we likely would not be able to do if folks are just buttoned up like we are today, looking nice and perfect and just going in to do our jobs, right? So I think it's really given us a nice lens into the humanity of everything.
That's exactly what I was going to comment on. One of the silver linings, I think, of the past 2 or 3 years that we've been through the pandemic and everything is that we've been able to be a little more real and a little more human with each other. And I hope that we keep that as we move into whatever this next phase is going to be for our companies. One of the things that we've experienced at Entergy had a culture that we were 100% on-site, not remote, hybrid, nothing. That was not part of our company culture. We worked pretty much remotely for the past 20 months, and now we're back. And we've realized we can do this. This can work. It's not going to impact productivity. And what has happened is now when employees need some flexibility because of a circumstance or a situation in their life. One of our team members is a grandmother, and her daughter is in the Army, and she had to deploy, and she has small children. She asked for permission to work remotely for a month so that she could help take care of the grandchildren while her daughter was deployed. And before the pandemic, that would have been, oh no, that's not going to work. And now it's like, oh yeah, we can do this. You can do this. And so those are the sorts of learnings that I hope we carry forward.
Okay, I'm going to totally throw the proverbial grenade now and ask you both, what about the other side? Hybrid, it's so true, has empowered so many of us to live more balanced lives. When we ask people why they prefer a hybrid setting, the first 3 things they mention is they don't want to do the commute, it's better for their well-being, and it's better for their family. So as an employer, good luck overcoming those factors in someone's life. It's so central to who we are. But the other side of it is, it's changed how we connect with our colleagues and coworkers. It's created challenges for how we can create development opportunities for new people who are joining our team. One of my personal experiences with the hybrid, non-hybrid world is, it works really great for me with people I've been working with for over a decade. It's been not so great to build the kind of human, person-to-person relationships that I need to build with people who are joining my team. Am I just in an island on my own? I want you all to reflect on those challenges. Obviously, we're finding ways to get around them. So maybe we can focus on how we do that.
I don't have any answers, but I totally agree. Definitely harder with those new relationships. And I think we have to be more intentional about how we connect and how we relate to people, but I don't have answers. Misty?
So my team actually grew significantly during the pandemic. So over 50% of my team, and they're globally distributed, started at some point during 2020 and up until a couple of months ago. And so you nailed it. It's just being intentional, and it's getting to know people, appropriately personally and obviously professionally, and creating whatever type of environment you can for folks that are in the office and seeing what happens organically as well. When I think about, opportunities for growth and advancement, like that's still something we're figuring out in terms of future of work. But I think about like proximity bias or recency bias, and we've all been on a Zoom call and they forget to turn the Zoom off, right? And some people are in the office and you see the meeting after the meeting is happening. And you're like, wait, what's going on? And so it leads to a sense of exclusion. And so it's actually getting really clear about what are your policies and what are some of the best practices that you're putting in place, right? So how do you take that conversation and socialize it beyond that meeting? And leaders really have to be held accountable to that. So one of the, I guess, a tactical thing I would say to address that is ensuring that if there is a high visible, high impact project that's available, there's a rule in place that it has to be presented to an entire team, not just a subset of a team before someone is assigned, and really thinking about the distribution of work so that it's not going to the same crew of workers that are, let's say, in a headquarter location in comparison to a more satellite office or an office that has a lower occupancy. But I do think that it is something that's difficult. We don't know the answers, and we're all like just figuring things out through trial and error. I'm sorry that you are having a difficult time with your new
No, that's, and I think we're doing the same. I think we're all really doing the same, and it really touches so much of what we're talking about with well-being, how to treat people, why it's important in a work setting. One of the other really big changes I've felt since this hybrid work and the pandemic has kind of come and hopefully gone, is a focus on mental health in the workplace. I grew up in LA, and I'm 42, so when I grew up, the only people that had a shrink were like celebrities and rich people. The pandemic didn't bring this to the mainstream, but I think a lot of us who didn't feel comfortable talking about mental health in the workplace context now feel that it's a completely legitimate thing to be on the lookout for as a leader, to create spaces for people in the workplace to deal with those issues. How do we do that as a corporation that's trying to focus on customers? Where do we find the balance in making sure that mental health is an important part of what we're focusing on for our workers, for our customers even, but it isn't getting in the way of us getting our jobs done?
So I'll jump in first and then turn it over to Misty. But if our employees aren't in a good place mentally, and their families are not in a good place, then they're not going to have their full selves and their full attention at work. They're not going to be able to do their very best in terms of taking care of our customers. And so we need to prioritize that and make sure that people understand that that they need to pay attention to how they are doing, and if something is not right, to reach out and use the tools that are made available to them to address whatever those issues may be. I was at, a couple years ago, I was attending a conference that was held at Deloitte Touche offices in Detroit, and I was really impressed. They had these signs around their building, and they were part of their employee assistance program, and it talked about how you need to make sure that you put the oxygen mask on yourself first, because then you'll be able to take care of your family, then you'll be able to pay attention to your job. And they had a very robust employee assistance program, and they made tools available to their employees. And so, that awareness is really important, and letting people know that it's okay to take advantage of those tools and not be stigmatized by it.
Yeah, I think, Patty, you're absolutely right in the sense that if your employees are not well, then they are totally not going to be the best to serve your customers. It's interesting that we think about mental health as separate from just overall health. And so I think that's one thing we can actually start to do differently and just look at it more holistically. The fact that the World Health Organization declared burnout as a real diagnosis just a few years ago is something that lets us know that mental health is something that we need to really focus on destigmatizing. And EAP benefits are great, but think about the time of when you're recommending an EAP benefit. It's at a moment of crises. It's when there is a performance issue and you're using that as a last resort before the next level of escalation. And I think it's important to understand the responsibility we all have as employers to have more robust, like whether it's programs, whether it's services, and the education around how to fully utilize them and reduce the barriers. So when we conducted our survey, over 30% of people say that they actually can't access mental health benefits because of the financial burden, or 70% say they're not as aware of them. And the last thing is making sure that they are equitable. And so when you talk about mental health being stigmatized for certain communities, you know, the Black community is one, the Latinx community is another, and definitely the LGBTQ plus community. So if you think about who you're partnering with for your benefits, you really need to educate them as well on the importance of having providers that actually match the demographic of your workplace, so that they don't have to necessarily relive trauma as they're trying to explain what is making it difficult for them to focus at work. And so I think, again, it's just looking at it as a holistic approach, like physical health and mental health can no longer be separated. And there are a lot of other, you know, boutique things that are popping up where they do matching for your employees that you can bring in to really increase the utilization of those benefits as they're needed.
Thank you. One of the things that has really struck out in our data at Gallup is the experience millennials are having with burnout right now. It's fascinating that we live in a time where there's a premium on talent, irrespective of inflation. I think everybody in this room is probably understaffed, looking for workers, looking for the right people to join their organization. Younger workers care about this stuff a lot more, and they talk about it a lot more in our work. That's what we found. So whether it is access to mental health support, whether it is the way the business that I work for does business, are they polluting the environment? Are they treating, you know, if it's retail, are they treating their suppliers in an equitable way? These things are actually more important to younger workers than other generations. Do you all see that on your teams and in what you do?
I'll share a couple of examples. So my role at the company, I run the social responsibility team. So we have responsibility for philanthropy and volunteerism, community engagement, and those types of programs, which, as you mentioned, are more important now to the millennial generation than perhaps previous generations. Two examples. There's an initiative that Entergy has supported for many years in Arkansas with the Nature Conservancy that worked for a long time to restore an area of, I think it was the White River, back to its natural state and make it available for hunters and recreation and camping and all of this. And we did interviews after this was all done. And one of the employees who participated, you know, volunteering on the initiative said it talked about how much it mattered to him that the company cares about the things that he cares about and the places that he and his family go to enjoy for recreation and boating. And he said, it just matters to me that I work for a company that does this for my community. And another example, we have supported for many years the American Indian College Fund, and unbeknownst to us, one of the local tribes ran in their newsletter a little piece about a couple of the students who received scholarships, and an Entergy employee who is a tribe member got the newsletter and then later reached out to my team to say, wow, I didn't know that the company did this, and it means so much to me that the company cares about my community, that they're doing this. Those are the sorts of things that I think reap so much value in terms of employee retention. So those are my examples.
Yeah.
Yeah, so interestingly enough, like our mission at Indeed is to help people get jobs. And so we always are thinking about the impact on the job seeker and our commitment to society. I lead diversity, inclusion, equity, belonging, and it sits under the environmental, social, and governance organization at Indeed. So we're always thinking about our impact on society in terms of carbon emissions. We think about social impact, and so every issue that's happening globally, we actually have what we call compassion circles or brave spaces where we bring in mental health experts so we can talk about the impact that these occurrences are having on our employee base. And what that shows is that we have a true commitment to really understanding people on a more intimate level because we recognize the impact it has on how they show up at work. And so, we've had some folks say, I've never been in a space where I can actually be this vulnerable and I can show this level of emotion and it not be held against me, but it actually has benefited my employee growth and development. And so what we're finding is that employees now or job seekers, they're interviewing us like probably harder than we're interviewing them. And so they are really looking for the through line to what's on your website, what's on your social media, what's the background of folks that are in leadership positions, what is your board doing, and what does that look like day to day? And so for them, they want to find real meaning in their work. They really believe in having purpose and driving impact in ways that we didn't think about it before. When I first entered the workforce, it was like, I got a great job, let me get a good income, and I'm here, and then I'm going to go home. Right now, there's really no separation, and so the workplace is really a sense of community where people find a sense of belonging. And there was a report recently that talked about the amount of time that you spend with coworkers relative to family, relative to your children, and we spend a lot of time together with people we work with. And so imagine the impact on society when you can galvanize a group of folks around an issue or multiple issues, and then your business is also supporting that as well.
Yeah, I think that if it's the same report, I think they said that you spend 81,000 hours of your life working, which adds up to like 9 years.
Wow.
Which I don't tell that to young people starting their career. It sounds like, but a lot of my reaction to that just right now is defined by the generation I come from, right? If our relationship with work is focused more or is informed more by the things you just mentioned, those 81,000 hours or 9 years are gonna feel a lot different, right? Than the, oh my God, 81,000 hours, I gotta stare at the screen and plug away these answers. To close, I wanna ask you both to share your best advice with this audience on how a business can support their employees' well-being. I ask that with the knowledge that some of us are really large organizations with huge boards and policies and plans. Some of us are small organizations that don't necessarily have those resources. What is advice that you can give that could be applied in all different situations? How does an employer demonstrate that they really care about their employees' well-being?
Misty, you start.
So I would say, regardless of the size of your organization, if you take a step back, I think one of the best things you can do is hire people that have backgrounds that will actually give you the information you need to actually serve the population. So if you're thinking about your total rewards team, your compensation team, your benefits team, if there is a lack of representation on those teams, it's likely that it's going to show up in the benefits that you put forward as a company. So I think starting there. What we've done at Indeed, we have what we call an iRewards Council. So many folks have employee resource groups. We call them inclusion resource groups. And so there's a representative from all 10, and they meet with our total rewards leader to bring forth ideas and information and organizations that might not be on the radar of a total rewards leader. And so that also helps to inform the strategy. And we've actually seen some pretty significant changes in a lot of our benefits that's making them more equitable and inclusive of all populations. And then lastly, I would say, don't be afraid to admit what you don't know. I think crowdsourcing is sometimes really, really helpful. And it doesn't have to be a top-down approach. I think definitely talking to folks that are newer in the organization that are bringing new ideas can also help with figuring out the best way to support well-being from a policy and a procedural standpoint. And lastly, I would say if someone brings forth an issue or a sentiment, I would say believe them. Let's not be dismissive of feelings of other folks, especially if it's different from your perspective, and just create that safe space, because I think that goes a long way, because it gives us information that we can then use to maybe build better environments for our employees.
I would encourage people to leverage the power of your employee resource groups, because those groups provide safe places where people can connect and share and be vulnerable, but they also provide a tremendous resource to the employer for insight in terms of how can we do a better job of addressing the needs that you have. So
I would only add that you also need to measure the well-being of your employees, because all of the things you mentioned are so critical, but are they working? And that's how we at least tackle the concept of well-being work, is that measurement.
At Entergy, we do an inclusive climate survey that looks at inclusivity from two perspectives. We measure how employees feel personally. How do you personally feel included, and do you have a sense of belonging here? And then how do you feel about the company? Is the company inclusive? Does the company foster camaraderie and teamwork? And we measure that on an annual basis and share all of those results and take action on places where we need to take action.
All right, folks, that's Misty Gaither from Indeed and Patty Riddlebarger from Entergy. Thank you for listening to us this morning.
Thank you.
Well, that was a lot to think about, and we're so glad that we started the day with well-being. And that kind of brings us to our next topic. And the next topic is around hidden disabilities. And I often get the question from people who participate in our events, like, how do you come up with the agenda? And a lot of times we sit down as a team, we listen to the companies we work with, we listen to the people who attend our conferences in the past, and we design an agenda that flows from one topic to another. But sometimes, as the event organizer, I exercise discretion and say, there's something I want to talk about. And this is one of the things that I chose. Around hidden disabilities, we're going to talk about hearing and vision. First, on hearing, it's something that's truly personal to me. As a 50-plus-year-old man, many people don't know this, but I can't hear out of one of my ears. I have about 10% hearing. I've not told that to many people in my life, so it's hard. If you sit on this side of me and you talk to me in a crowded room, good luck. I can't hear a thing you say. But fortunately, the other ear is fine, and so I adjust. So when Misty was talking about transparency and exposing vulnerabilities, it's actually a strength when you do that, and I think it helps. So we're going to talk about what hearing loss means across the world, what people are doing about it, and then we'll talk about vision loss and what companies are doing about it, and we have some experts here. Our first expert on hearing, Michael Scholl is the Executive Vice President of Corporate Relations for Starkey, which is the world's largest hearing aid manufacturer. He can't be here, so he sent a video. So we're going to watch the video, and then I'm going to come back out, and we're going to talk about vision. Appreciate that. Thank you.
Good morning to all of you in Washington, D.C. I wish I could have been there this morning, but unfortunately I'm here in Minnesota where it's a balmy 29 degrees. My name is Michael Scholl, and I'm the Chief Compliance Officer and Executive Vice President of Corporate Relations at Starkey Hearing. Starkey is the largest hearing aid manufacturer in the United States. We're headquartered just outside of Minneapolis and have over 5,000 employees across the globe. When we're talking about hearing health and when we're talking about managing invisible disabilities, hearing is at the top of the list. Over 45 million Americans have some sort of hearing loss, and about 35% of those folks actually do something about it. For the last 55 years, Starkey, privately held, and our founder, Bill Austin, has been focused on giving back, not only helping folks across the country with the hearing help that they need, whether it's via our own retail locations all across the United States, our thousands of customers across the United States, the work that we do with the Department of Veterans Affairs, the DoD, but also through our corporate social responsibility program, Starkey Cares. Over the last 50 years, the focus at Starkey has been all about caring. The very first set of hearing aids that Mr. Austin manufactured over 50 years ago were designed and made for somebody who could not afford the help that they needed. From that point on, we've always had a policy at Starkey of anybody who needs hearing help, we're able to help them. And we do that through our corporate social responsibility program, Starkey Cares. Over the last few years, we've redefined what Starkey Cares mean, and we've defined 3 pillars of our corporate social responsibility program. The primary pillar is that Neighbors in Need program, which is designed to help just that, to help people, to help our neighbors all across Minnesota, all across the United States with hearing help. We have a program where individuals who may not have a third-party benefit, may not be able to afford the hearing help that they need, they can go into one of our over 2,500 hearing help partners across the country. They can be tested to identify that they have a hearing loss, and then they work with that local hearing healthcare professional to identify the next steps. And if that means Starkey Cares, they complete an application, they go through the vetting process, and then those who are identified as being Starkey Cares recipients, Starkey provides the hearing aid at no cost, and then our local hearing health partner, whether it's in Minnesota, Texas, New York, or California, or anywhere in between, they provide the testing, the fitting, and all of the follow-up care for that patient. And from a business perspective, not only are we giving back as a hearing aid manufacturer, but we've really leveraged our Starkey Cares corporate social responsibility program to support our customers as well. Our customers, hearing professionals, audiologists, hearing instrument specialists all across the country, they want to give back to their local communities as well. So it's really become a partnership. We benefit by ensuring that individuals with hearing loss have the best technology. Our local partners, our customers benefit by ensuring folks in their local community have the help that they need. And obviously, above all else, is individuals who have hearing loss, they get the help that they need. And it's a three-legged stool is how we view it. It's what's best for the patient is best for our customer, and ultimately that's what best for Starkey and all of our employees here in Minnesota and all across the globe. That's obviously the primary focus of our corporate social responsibility program, and we leverage this from a business perspective as well, working with our customers. Our other 2 priorities in Starkey Cares are our focus on veterans and then our focus on partnering with like-minded groups across the globe. As I mentioned earlier, we sell a lot of hearing aids to the VA. In fact, tinnitus and hearing loss are our top 2 combat-related injuries for our military men and women coming back from active duty service. The VA purchases 1 million+ hearing aids a year to help our veterans. Not only do we support veterans with our hearing technology, but we've made it a priority to support veterans and veteran service organizations at the national level and at the local level with our support. We, again, work with our customers to identify these veterans groups who can use and need support in their local communities. And then our final priority, as I mentioned, of Starkey Cares is our work with organizations across the globe who share like-minded interest of giving back. As I said, Starkey was really founded on the basis of caring, and that's our priority. One partnership that we've entered into just over a year ago is a partnership with Special Olympics International. Any Special Olympian across the globe who has hearing loss, once they are identified, Starkey will provide them with the hearing help that they need, not only the technology, but with our global network of hearing professionals, we ensure they get the local care and follow-up that is needed as well. This is a partnership that has led us to the U.S. Games in Orlando. We're looking forward to the World Games in Berlin. In a few years, the U.S. Games will be back right here in Minneapolis. And again, our CSR program, our Starkey Cares program, is not only identified and designed to help individuals who have hearing loss. It's not only designed to give our employees across the globe something to be proud of, but we use it from a business perspective to support our customers as well. In all three of our pillars, Neighbors in Need, our support for veterans and active duty military men and women, and finally, our partnership with like-minded organizations like the Special Olympics International. In all three pillars, we tap into our employees and we tap into our customers all across the globe, and they help support the corporate social responsibility work that we are doing. As I said, we've relaunched this a couple of years ago, and we have over 2,500 partners across the globe that we're working with, and we're on our way to expand that to, well over 3,000 and into 4,000 hearing healthcare partners. Again, 55 years ago, we were founded on the idea of caring and giving back, not only to our local community, but globally. And from our perspective, this mission, the mission of CSR, the mission of Starkey Cares, is a foundational pillar to our organization, not unlike our commercial team, our finance team, our operations, our marketing. Starkey Cares is what we're all about. And we're happy to share this with you today, and always happy in the future. If you have any questions or individuals that might need help, Starkey is always there to help. So have a wonderful rest of your day. Again, sorry you could not be there in person, but Starkey, no pun intended, we're all ears if you ever have questions. Have a wonderful day.
Well, we want to continue the conversation around well-being, and we're going to focus on vision now. I'm so glad you're here. This is Kristen Gross. She's the Global Head of Knowledge and Advocacy and Partnerships for the OneSight Essilor-Luxottica Foundation. And before we dive in, if you don't mind,
Yeah.
I talked to you about hearing, we're going to talk to you about vision. I can see fine, except when I read fine print. So I have one of these in my pocket, and it's been exacerbated by COVID as I spend more time in front of a screen than I do in front of people. Can I see a show of hands? Who has glasses or reading glasses and uses them regularly? That is a lot of people.
It's a lot of people.
Now imagine if you didn't have access to those. What would your life look like? What would your work look like? Is there anyone here who could do their job without them? Not really, right? Just barely. So it's pretty impressive, right?
It's pretty impressive. And I would say to you that you're not alone. 1 in 3 people in the world right now, though, needs glasses and doesn't have them. So it's 2.7 billion people that we're still trying to reach with just a simple pair of glasses and a solution that has existed for hundreds of years. The fact is that even $272 billion in lost productivity every year because people can't see to work. So we can be very grateful. I think that we live in a place where access is given to us, and generally we can afford that solution.
Well, tell us about Essilor-Luxottica, right, and OneSight. What you probably don't know in the audience is if you have glasses or even sunglasses, you probably have their product.
I would be surprised if you didn't. So I will just say this, Essilor-Luxottica is a company that exists only since May of 2020. We were 2 independent organizations. Essilor was the leader in ophthalmic lenses around the world, and then Luxottica was the retail and frame leader around the world. And we came together really because there was no overlap in services in this company. So the fact is we needed to figure out a way in in the sector to provide a full solution. And the two organizations came together for that. We're 188,000 people in the world in 150 countries. Not a small organization by any means. And probably if you wear Transitions lenses, Verilux, Crizal, if you have seen a Sunglass Hut, Lens Crafters, Oakley, Ray-Ban, Chanel, you name it, it's probably us. So thank you for your support.
Can I brag a little bit more?
Sure.
What about Foster Grant?
Foster Grants as well. So
And part of Warby Parker?
Warby Parker lenses, yes.
Right.
So yes, definitely not necessarily a well-known company, but well-known solutions around the world.
Yeah. So we've identified the problem.
Yeah.
What are you doing for the solution?
Yeah, I think this is where it gets sticky, right? Because you think that everywhere around the world you should be able to just, like we looked in DC yesterday, walked around this city, and how many places there are that sell eyeglasses or do an eye exam. But when we look at the 2.7 billion people who still don't have the solution, or the 1 billion people who don't have access, we define access as they can get an eye exam and a solution within 1 day's travel from their home. So we're not just talking about I can go 5 minutes around the corner and have my eye exam. In 2019, Essilor and the Essilor mission team wrote a full paper basically around eliminating poor vision in a generation. And it's a full roadmap that's set out to say, these are the 4 ways that we will address the problem. One of those ways is sustainable solutions. So whether that's vision centers in different countries, whether that's training up micro-entrepreneurs to actually take vision care, primary vision care to rural entities. This is kind of where we're working. It's philanthropic, but it's all of those together.
Yeah, and yesterday we talked about economic mobility.
Right.
And thinking about what you just said, there's an opportunity not just to create jobs through vision, but you're actually enabling other people to have jobs.
That's exactly right.
So how does that come to life, particularly in lesser developed countries?
So we started a program called iMitra. iMitra in Hindi means friend of the eye. And so the program that we started was in India with 8,000 now iMitras that are in the different rural communities. One of the things that we looked at was what is lacking in vision care. There were so few eye doctors in India to reach the 1 billion people in the country, and rural communities really had no one. There were also people who actually didn't have jobs, who couldn't pay their bills, who couldn't support their families and their communities. So we did something where we started this program in the rural communities. We went out and looked at who was available to do these jobs, and generally it was the people who would be blue-collar workers. It would be farmers and other people. We chose young adults who could be professionals to train up to create their own solutions. So they would have their own shops. They would have marketing that we would help to support them. The training is 6 months, and then they can actually provide basic refraction. Right now, we've developed a telemedicine option where they're connected to eye doctors in rural hospitals as well, or in urban hospitals, where if they need to actually send a patient to a doctor, not just for readers like you're wearing when you need to read up close, but there's an actual problem, they have that delivery model as well.
Wow. So
there are 20,000 around the world. So we've gone from just being 8,000 in India to Africa, where we have the iRafiki, in Bangladesh, where we have iMitro and other programs as well.
So if there's 20,000 now, how many do we need to solve?
I would say probably at least 100,000, and that's still including increasing the number of eye doctors that are available as well.
So you're in a room full of companies and nonprofits who their heart's in the right place.
That's right.
They help on issues all over the world. and all different kinds of issues. Perhaps they've not entertained this notion that they can get involved to help companies like yours.
Right.
How can they approach you and how can they partner?
You know, I think it's pretty easy. Just call me, number one. As a part of the partnerships pillar within the foundation, I can get you connected to the right people. But one thing that I would say is that, you know, when we talk about invisible disabilities, we're talking about those things that if I didn't have a pair of eyeglasses on my face, you wouldn't know that I couldn't see up close either, right? You wouldn't know that I had something going on here at all. I'm going to kind of back up from your question a little bit because I think it's really important to say that there are really 4 reasons why people aren't wearing glasses who need them. One is access, which we've said is a little over 1 billion people who still need access to vision care. The second one is affordability, and affordability is defined as a pair of glasses, 3 days' wage is what most people are willing to pay for a pair of eyeglasses. Which is still extremely expensive in some areas. And then you have awareness, which just means, hey, I could actually see better if I had a pair of eyeglasses, or there's a solution out there that can help me because I don't even know that I can't see. And then the fourth one really is acceptance, and acceptance is huge. There are countries all over the world where people don't even understand that a pair of eyeglasses makes you effective and not defective. So when I say that this invisible disability, in a lot of places, if I put a pair of eyeglasses on someone, they believe that they cannot be hired to be a driver in India specifically, because someone will think that they're broken. There are girls still in the world today who they're being told they can't get married because they have a defect if they wear a pair of eyeglasses. It's still happening. And the interesting thing I think for me is that in the United States, all of those cultures are here. So we still face those same battles even here at home today. And I think it's important to call that out. When we talk about partnering with other organizations, we know, I mean, EssilorLuxottica is a huge company. We have 188,000 people. Okay, maybe we could do this. If we wanted to, if anybody could do it by ourselves, we could do it by ourselves, but we can't. The solution requires all of us to be involved. And I think it's important to mention this as well. First thing, number one, if you're a company and your people are still having to decide whether they take up the vision care plan or not because it costs something to them and they opt out, I think that's a problem. And I think companies need to say, this needs to be a part of what we provide to our employees. It should not be an opt-out. The second thing is those communities in which you serve, they need to be able to see. Children can't learn if they cannot see. Workers can't work if they cannot see. Drivers are terrible drivers if they cannot see. I'll give an example of India just really quickly. We did some studies in India around road safety. There's a tremendous reason why the roads are not safe in India and in many places around the world. But vision care, if you look just at the fact that someone who says, I've had an eye exam in the last couple of years, and those who say, I don't wear glasses or I haven't had one. The gap in between in road safety is 30% higher crash rate for those people who have poor vision. Now, if you just took that 30% off the table by providing glasses to those people, even if it's just the heavy truck drivers, you've changed the way that those people can live and be productive in life. So I think that partnership aspect is first do for your own, and then come to us and let's work together to do it for the rest of the society.
Now, Kristen, I'm glad you said that because there's clearly an intersectionality here, right?
Absolutely.
It's around public safety.
Absolutely.
It's around education.
Absolutely.
But there's still that stigma of glasses,
Yes.
and it affects people's mental health that they don't want to raise their hand and say, I need help.
That's right.
What do we do to address that?
I think COVID made it very difficult because if you kind of look at where we were during that time, everybody was isolated. You mentioned that your vision is worse because you're on screens and those types of things even more. We saw that happening also with children. And very specifically, some studies coming out of China that said the rise in myopia or distance vision issues is huge because of the shutdown, not necessarily just because kids were on their tablets doing their school, but because they couldn't be outside. They couldn't have that vision at a distance, that their eyes need the break to be able to continue to see in the distance and work that way. We know that studies show that myopia is still going to be progressing. Half the world population by 2050 will be myopic if we don't intervene today. Vision and mental health all goes together. You have people who are isolated. If you cannot see, you can't get out. We have elderly people who are isolated even more by poor vision. And I think it's something that as we address, we have the opportunity to address a single issue that can change a multitude of problems with just a simple solution.
Yeah, and I think for the businesses in the room, one of the things, and I'd be curious if there is a study that exists that actually shows in terms, and we heard it in the previous panel, about kind of absenteeism, presenteeism.
Absolutely.
In the workplace itself, lost productivity, people aren't showing up.
That's right.
If we can somehow calculate what the savings could be if people were able to take care of their vision,
Yeah.
their employers are able to help them do it in a much more robust way than they do now, it's actually going to be a plus up for companies.
Yeah, for sure. And I mean, even just the 272 number, the 272 billion in lost productivity, that doesn't even take into consideration your reading glasses. So it doesn't take into consideration people who are 40 plus, who are just needing a near vision correction. It just takes into consideration those people who have mostly myopia or other eye problems that need glasses. So the fact is those numbers are tremendously higher. And if we have employers who are willing to invest in their employees' families, I would take it a step further and say this should be a family benefit. Because if their kids can't see, then their kids aren't learning at the rate that they need to. They are not going to be the next level productive workers either. And I think that that's critical.
Yeah, it's for those who work for companies, even for the nonprofits, I think we're in open enrollment season.
Yeah.
In fact, the chamber's closed tomorrow, and I got to make sure all my I's are dotted, T's are crossed for my benefits. But I noticed that the blue light lenses are now eligible for healthcare, FSA. So
That's right.
What kind of difference would the blue lights make in terms of those who are in front of screens?
Yeah, so it's really interesting. Our company, Essilor, was one of the first first organizations that actually put out a blue light lens. And for children, it's critically valuable for eye strain and those types of things. Especially, like, I have a son who played a lot of video games.
Me too.
A lot. And we just found out he's having twins in a couple of weeks, and I'm like, you're gonna have to get off the video games, dude. It's time to, let's get some work done. But I just threw him under the bus, didn't I? That wasn't nice.
Have him call me, because I have twins. I'll tell him.
Oh, no. So, I think, yeah, definitely blue light lenses are important. There are a lot of doctors who are actually, a lot of the lenses now actually have blue light filter built in. So you don't really have to, worry so much about getting a blue light coating or one that's a blue blocker that blocks all of the blue. You don't want that because that affects sleep and all of that. But definitely, if you've got kids in a setting where, hybrid learning and those types of things, it's critical.
So one of the things that we do for all of our sessions is we want one big takeaway.
Okay.
That if this crowd is going to remember one thing when they walk out here, when it comes to vision, what should they remember to tell their colleagues, their partners, and really a call to action?
I think personally, we each have a responsibility to our own vision. You have two eyes. You're not going to get any more. And so I think number one is, get your own dang eye exam. If you don't do anything at all, get your eye exam. You're at the end of the year, you still have dollars to spend. If you haven't done it, get it done. And I'm looking at you people, because I know you haven't, because I just got mine, and I work for the companies that do it. So if you haven't done it, get your eye exam. The other piece would just be, think beyond where you sit. We talked about kindness. We talked about, we've talked about a lot of things about, thinking beyond just who we are in our own work settings. Think about the 2.7 billion people who do still need a pair of eyeglasses. And if you guys have the opportunity to get them, then be that responsible person that gets them. I think that's it. And, we have so many opportunities to change the way the world sees. I think it's on us as companies to really bring to light and take those invisible disabilities into visible. Let's make them more visible. Let's break the stigmas that say, I can't wear a pair of eyeglasses because it makes me look defective. Why can't I just be effective? So I would challenge you to walk away with, my glasses make me effective. I'm no longer defective.
And that's really the whole mission of your company, right?
That's right.
See more and be more.
That's right. See more and be more means I can learn better, I can work better, I can live better, I can continue to be a productive member of society because I can see well.
And I would say, unfortunately Starkey couldn't be here, but for their company, everything that Kristen just said about vision, it applies to hearing as well.
Absolutely.
Right? Get your hearing tested, help those inside your company, help those in your communities be able to hear better, because if you can't, it's going to be hard to learn, right? You may not be as effective at work, and there's a real economic effect to this,
right,
as well as a societal effect on having these hidden disabilities in terms of vision, in terms of hearing. And this is really why we wanted to bring this up as an issue and have it trail what Gallup had found about well-being, because all those things about anger and stress and unhappiness,
absolutely,
this ties into that, right?
100%.
Yeah.
Absolutely.
Well, we're going to be around for a while, so if you find us in the back of the room and you want to talk about this, can they approach you and say,
yeah, sure,
we want to help?
I'm more than happy to talk to anybody. Thank you.
That's great. Thank you. Thanks,
so
everyone.
much. Thank you.
Yeah, that's right. He's got it.
Good morning, everybody. Thank you so much for joining us today. I'm Catherine McKenzie, and I head up Global Citizenship and Sustainability for Abbott. For those of you who don't know Abbott, we're a global healthcare company, and we're focused on bringing life-changing technologies and products to improve people's lives. And that's why I'm really thrilled to be here today to lead this discussion on the role of businesses to achieve better health for all. I'd like to thank the Chamber of Commerce Foundation, first of all, for convening this important discussion with our esteemed panelists, who I'm going to introduce in just a moment. Good health is the foundation for everything. It is what leads the backbone of thriving individuals, of economies, of societies, and it's what makes the business case for advancing health so compelling. And I think that's something that's been vividly illustrated these past years with COVID. We've seen the impact of that on our own lives, on our communities, on our workforce. But the pandemic only accentuated a number of systemic issues and barriers to health that have existed for a long time. As we look ahead, health threats and the environment are only going to become more challenging. And I want to start with a couple of key stats. By 2030, the difference in life expectancy between rich and poor countries is going to be 18 years. We are going to need 20 million additional more healthcare workers. And by 2029, spending on healthcare is going to double to nearly $16 trillion. In short, our world needs new approaches to health. And breaking down big systemic barriers requires a shift in thinking, innovative business approaches, and meaningful partnerships. This is something we've been thinking about for a long time at Abbott. We have an ambitious goal of reaching 3 billion people in the world by 2030. And to do that, we need to change the way we're approaching business. Business as usual won't get it done. So first of all, we are working on intentionally designing, innovating for access and affordability into our processes, from research and development to the way we bring products to people who need them. And in partnership, we're looking at new approaches to health in a very integrated way, whether that's an initiative about diversity for clinical trials or through partnerships like our Future Well Communities program, where we're supporting people with diabetes through a very integrated approach, whether that's access to health, healthy food RX, and looking at those other societal determinants of health. So we're seeing similar dialogue happening across industries, and that's why it's so fantastic to be with both of you today. And I'd like to introduce my panelists here. First of all, I'm pleased to introduce Dr. Jay Batt, Executive Director of the Deloitte Center for Health Solutions and Deloitte Health Equity Institute. Jay, I know Deloitte recently made a $1.5 billion commitment to advance equity and build on the work of the Deloitte Health Equity Institute. We also know you're on the front lines of healthcare as a practicing physician, so looking forward to hearing about those experiences. And Tracy Malone, Senior Vice President of the United Health Group and President of United Health Foundation. Tracy, I was excited to see United's recent $100 million investment to address healthcare worker shortage and support clinicians from underrepresented communities. As this builds on your leadership in advancing health for veterans, both as United Healthcare and during your distinguished career in the Navy. Both are strong leaders in their fields, and I'd encourage everyone here to go onto the Business Solves website to read their full bios. So let's get started. We must start this conversation with acknowledging that healthcare, as it exists today, is leaving behind too many people who need it most. The pandemic really brought attention to these health gaps and structural barriers, but they've long been there. So we're going to start today by hearing about your perspectives on these health disparities and how do healthcare disparities impact health equity. So why don't we start with you, Jay, and then we'll continue with Tracy.
Great. Well, good morning, everyone. It is an honor and privilege to be here. Catherine, thank you for that kind introduction. And Tracy, thank you for your leadership and work, along with Catherine, on these really critical issues facing our nation. And just want to appreciate the U.S. Chamber of Commerce Foundation for their leadership in bringing this collective dialogue together. So for me, I see the ills of our country show up in my exam room, on my telemedicine visits, in the homes of patients I care for. And I've come to the realization that health inequities is America's chronic condition. We've continued to put Band-Aids on or not even address these issues rather than thinking more upstream about them. And so the way that, I think about it is I give you an old adage: give a man a fish, feed him for a day. Teach a man to fish, feed him for a lifetime. But when we think about the complexity of health equity and that old adage, what about teaching women? What about communities that are historically denied fishing equipment? What about the pond being polluted? That's what health equity certainly, that's how it shows up. That's what it means to us, and that there's differences among people where there shouldn't be those differences. And so how do we give everyone the possibility and the opportunity to have a fair and just shot at health and well-being? And so at Deloitte, we know health equity, is being more than just equal access to care. It is about this fair and just opportunity for everyone to have the highest potential for health and well-being. And we know that health disparities are impacted by drivers of health, and that we use that term drivers of health because of that we believe that things may not be determined, that there are things that drive what happens. And I say, I send my patients back to the conditions that make them sick, the communities that have been historically disinvested in. So we could do everything right clinically, but they could still have worsening health outcomes. And so health disparity is a metric on which we measure progress on health equity. So that's how I'd say the two are connected, and that, I look forward to further conversation.
Great. Thank you again, Catherine, and it's great to be here at the Chamber Foundation. Great to be in person. United Health Group has been a long-standing partner of the Chamber Foundation, and just so exciting to have this conversation today. And Jay, thank you for being here, your leadership. I hope you all will go and look at Jay's bio online, because he's had quite a distinguished career, and he's still seeing patients. So when he's speaking, from real experience. I'm reflecting on what you said, Jay, and I think you're exactly right when you describe what health inequities are. And when we think about that in health, about 80% of what influences a person's health actually happens outside a medical clinic or a doctor's office. And we really look at data at the population level to get insights on what are causing these health disparities. And the United Health Foundation has been looking at this for years through our America's Health Rankings platform. Some of you may be familiar with that. It's really the longest running state-by-state analysis of our nation's health, and it looks at health across 160 measures of behavioral, economic, social, and other factors. And we're able to use this data to really identify health disparities by race, ethnicity, gender, age, geography, income, and education to really inform the actions we take as a company to advance health equity. Last year, we issued our inaugural America's Health Rankings Health Disparities Report, which really focused on the depth, breadth, and persistence of health disparities. And here's some of the things that we saw that were really concerning. Women have a 70% higher rate of depression compared to men. And those with less than a high school education actually had 123% higher incidence of frequent mental distress. Even more concerning were the widening racial disparities that we continued to see in maternal health, which I'm sure we'll talk a little bit more about today. But the persistent disparities for Black mothers and their high rates of maternal mortality. And we look at these, we issue reports at a population level. So we look at women and children, we look at seniors, and we also look at veterans. And I just wanted to give a shout out to the Summit Behavioral Health Care, who won the award yesterday for their work with veterans. As a veteran, I really, really appreciate the work that you're doing. So thank you again. So, and we take that data, and how we put that into action is we really use it to help us formulate our community partnerships. And I just want to give one quick example. When we issued our Health of Women and Children's report in October, we saw that there was a 20% increase in mental distress for children. And even more concerning was almost a 30% increase in the teen suicide rate over the last 5 years. And so we took that data and we established a new partnership with a nationally recognized organization called Active Minds. And I think Active Minds actually might be represented here today, but really great partnership that we're embarking on to establish a new program at the middle school level to try and get upstream a little bit on these health disparities that we're seeing for youth around mental health. We're going to establish this program and implement it in 50 school districts across 3 states, and we're really excited about scaling this partnership going forward. One last thing about America's Health Rankings, we're going to be issuing our annual report in December, where we're going to really provide the broadest portrait to date on the impact the COVID-19 pandemic has had on health, especially the toll it's taken on a number of our racially and ethnic diverse groups.
Tracy, I want to just pick up on this point about data because it's so important that you made, is the data drives insight, drives action. But I hear a lot about, well, we don't have the data, we have to go get the data, we have to go find. Yes. Actually, you can interrogate the data that you have and ask the question. So it's the curiosity about what questions you ask. So we looked at even our dashboard with Sergio Ventures, where people in highly vulnerable communities are 32% more likely to have COVID than those that are not. But you even look at the ability to work remotely, highly correlated with education, which has an impact on others. Black, Hispanic, Native Americans 2 to 3 times more likely to die. But so we can even, from gender to place to a number of different places in their public data sets to use. We released a report this summer that's really been a clarion call about the cost of health inequity. So it's not just a moral imperative, there's a business imperative. So it's $320 billion we estimate today, $1 trillion in 2040 if we do nothing different, 1,000 per person today, 3,000 per person in 2040. So that's report's available to all of you, but it looks at a number of common conditions where there's differences, and then offers some thoughts about what we can do about it.
Well, some compelling statistics. And I love that both of you, as we've talked about health equity, have really defined that in a very holistic way, right? That when we're talking about health, we're thinking about physical and mental health, but also that we're thinking about individuals, about populations, about subgroups of those populations. So I want to move the conversation a little bit onto access. And we always talk about access as saying, the best healthcare solutions are the ones that can reach the most people. But that is really a challenge. So I'd love to talk about, how you're looking at improving health access, to advance health equity, and what are some of the unique capabilities that you're bringing to kind of form that approach. So maybe we'll start with Tracy on this one.
Sure, great question. When I think about our company's mission of helping people live healthier lives and helping the health system work better for everyone, I think about how we believe that achieving health equity is really helping people live healthier lives, but providing them the care and the support they need to achieve their optimal health. And Catherine, as you said, access is key to this. And we heard this yesterday in the panel with Johnson & Johnson. I thought they did a wonderful job talking about their race to health equity. And I know there are other colleagues from the healthcare industry in the audience today, and I think we're all focused on how do we get at this. And at United Health Group, we've been focused probably for over 2 decades in trying to identify, address, and monitor health disparities to really improve access. And our focus has been on really closing those gaps in care, particularly for vulnerable populations, and providing them both the medical and the social support they need. And it's not only the work we do in the foundation, but as a business, we're really focused on this. United Health Group cares for a large number of seniors across the country, and in our Medicare Advantage program. And one of the programs we've put in place over these last few years is to provide in-home, high-quality preventive care services for seniors, as well as screening these seniors for social determinant of health needs, and we've screened over 6 million last year alone. And we think about access. I think we also need to talk about ability to access and afford life-saving drugs like insulin. And one of the things United Healthcare has done is eliminated out-of-pocket costs for their members for insulin and other life-saving drugs this year. And also providing integrated care in our community pharmacies so for medical and behavioral health care. And we've seen a 90% increase in patients' medication adherence rate. And it also comes back to something that you also mentioned earlier, which is social determinants, providing the necessary food, transportation, and housing that people need to live their best lives. And we do that really in partnership with the community.
That's fantastic. And you know, to everything you're saying there, access is so much more than bringing person, patient, right, to product or technology. If we don't look at that fuller picture, right, then that alone will not be enough to make a difference. Jay, do you want to add to that?
I think, Tracy, well said. And I would say that access is also connected to information. Misinformation and disinformation that can impact how individuals may think about access in addition to not having it. So when you have access, I see patients that may have access, but they don't have the literacy to engage and use the care system effectively for them. Or they have information that gets shared across the community that then impacts their ability to access care. But I think what we're at the Deloitte Health Equity Institute thinking through is the three inextricably linked issues that we're solving for. One is racism and bias inside and outside the healthcare system. The other is structural flaws in the public health and healthcare system, and then the deep inequities in the drivers of health that Tracy was mentioning. And those three inextricably linked problems are ones we're uniquely positioning Deloitte to solve for through a theory of change that includes three levers. One, influencing key decision makers. So we've worked with the Black Directors Health Equity Agenda on a playbook for boards. We've convened 30 organizations through the World Economic Forum's Global Health Equity Network, which we collaborated to stand up, where organizations are making commitments on climate sustainability and equity. And then two is strengthen place-based change programs, place-based inequity. So do you bring fragmented stakeholders together around issues like maternal health, COVID, mental health, and workforce, and chronic disease so that we get to better outcomes. And then driving health equity innovation, where we're creating a health equity catalyzed cohort with New Profit, which I'll talk more about, to social entrepreneurs, women and people of color and people from rural communities that may not have a platform to drive their innovations forward, giving them that opportunity in a community and support. So, I think that access, affordability, information, and literacy, are all sort of linked together.
Absolutely. And, you're both highlighting that health equity is so expansive, right? It's a huge and complicated thing to tackle. And I know that people often say for complicated problems, there's often a simple solution. That's not the case here, right? For these complicated situations, we often need complex solutions. And companies like Deloitte and United Health Group have invested multi-million-dollar investments in tackling this head on. So I want to now just get very specific on impact, because we know when we go in with investments like that, we want to be able to show impact for that. And we can maybe talk about some of these very specific examples. I'm going to jump back on what Jay just said about the fragmented stakeholders. Would love you to talk first about, how you're bringing those fragmented stakeholders together.
Sure. I think that you referenced the investment earlier. That's over 10 years for social impact on education and workforce, health equity, as well as financial inclusion. And all of those elements being important, tied to the work of our Purpose Office, so our Chief Purpose Officer, Kwesi Mitchell, and our Citizenship leader, Doug Marshall, really helping team with us to drive that. Since we started, we've launched 20 collaborations in the community across those 3 levers of change that I referenced earlier, touching directly 20,000 people, indirectly nearly 2 million. And an explicit part of the strategy is to, in one of those areas around place-based change, bring a coalition together. So the Greater Washington Partnership here in this area is an example where we're supporting the work of inclusive prosperity, bringing employers, healthcare organizations together, because we know that the ecosystem matters to make progress on health equity, that everyone has a role, and that if you're taking care of employees, if you're paying taxes, you're in the business of health, because every company is a health company in that regard.
Yes.
And so what we've done is invest in ways to leverage new ways of working and leading edge analytics and research. So New Profit, which was founded in 1998 to catalyze a nascent social entrepreneurship movement, has then backed, since then, 150 social entrepreneurs who created powerful ideas, tools, organizations, and movements to address entrenched social problems. So we've created 2 cohorts, one that we're launching on mental health specifically here in the next month, but one we did earlier around health equity, where we provide 100,000 unrestricted funds, deep capacity building support in a community and ecosystem, and bring various perspectives to that. The other is March of Dimes, where we worked with them to create a maternity care deserts dashboard. And so we can look at the location of maternity care deserts, the quality of care received, as well as the relation between maternity care deserts and drivers of health. And that then helps say, well, what are the interventions we need to drive forward, where, and who are the ecosystem players that can come together on that and play their role. So, when we look at women's health, there is a clear evidence that suggests investing in women's health has a direct economic impact on society. And so that, ends up being an important piece too, where we're focused on also unlocking scale opportunities. So community health workers is another area where it's not scale in this country, but in the developing world, globally, and in other parts of developed countries it has, there's reimbursement, workforce, other issues. So can we invest in a way that unlocks evidence and data and approaches to help scale? The same with diversity in board and leadership. Diversity and inclusion can lead to better outcomes. And when I think about health equity, I think the investment in the work organizations drive forward in it changes the basis of competition, because our workforce and communities are looking at companies to what they do in these areas of climate sustainability and equity.
And that's a great point as we think about that from an ecosystem perspective, and building on that really around the workforce. Tracy, I know United Health has a focus on building a racially and ethnically diverse health workforce, which is something that we're really focused on at Abbott as well. Perhaps you can talk a little bit to that and why you decided to start with this approach and this focus first.
Sure, I would. I just want to pull on a few things that you said, Jay, before I go into the workforce, because some of the common things that I heard you say is this has been a journey for Deloitte. It's certainly been a journey for United Health Group. It's years and years of investment. I really, we are so much aligned on the focus on women's health, on particularly maternal health care, and the work you're doing with March of Dimes is just phenomenal to help them target their activities in those communities. And you mentioned workforce. We've been talking a lot about health disparities, particularly in the maternal health area. And what research is showing is that culturally competent care can actually improve a patient's experience as well as their outcomes in care. And if you think about it, in the United States today, Black newborns are 3 times as likely to die as white newborns. And that's just really appalling. A recent study showed that when Black newborns had a Black physician caring for them, it cut that mortality rate in half. And I think fundamentally our health workforce is not diverse today. It's not as diverse as it needs to be in order to provide the high quality care that's needed to care for all patients. You look at the US population, and Blacks and Hispanics make up about 30% of the population today, yet there's only 10%. They only make up about 10% of the doctors and nurses treating patients today. And that's why United Health Foundation has made a $100 million commitment to help advance a more racially and ethnically diverse health workforce over the next 10 years. This is the largest philanthropic investment our foundation has ever made. But it is built on a lot of the work that we've been doing for many, many years. We've invested more than $25 million to help students of color pursue primary care careers over the last 15 years. And we've also invested more than $10 million to help grow a more diverse health data analytics workforce, knowing that's a key part of the health system, working in partnership with HBCUs and organizations like the Atlanta University Center Consortium, as well as University of North Carolina at Chapel Hill, to attract those students into these health data analytics program. And one new program that I'm really excited about is our partnership with the Harris-Stowe State University in St. Louis, where we are supporting the development of a bioinformatics program, the first one they've ever had at the undergraduate level. But given the growing disparities that we're seeing and the ongoing challenges, we really felt we had a responsibility to do much more. And that's why we're really excited about deepening and scaling this commitment to advance a more diverse health workforce.
Yeah, Tracy, we're so aligned on, as you've said, because of the workforce issue, tying it to even maternal health. We know that diverse, empathetic care teams can make an impact on outcomes. And then having workforce reflect the diversity of the communities they serve. So we've invested over a multi-million-dollar investment in Morehouse and other historically black colleges and universities around workforce, upskilling and development, and maternal health, and looking forward to grow in that space. But I think you're giving people the capabilities and skills to contribute. And I often say that health equity moves at the speed of trust. That trust is also so important that the stronger you build trust, the sooner you build it, the better it's going to impact outcome. But you can lose it very quickly as well. So sustaining that trust, and we talk about measuring how are you building and sustaining trust in organizations and communities.
I am seeing some nodding heads in the audience here right now. If you think about the title of this conference, Business Solves, we are hearing that right now, and we're talking about this alignment, across all three of our organizations. We know there's many more out there, and I love just how you're getting into this kind of big system thinking of saying this is not just about the workforce today. We think a lot about the workforce of tomorrow and how are we getting, a very inclusive, diverse population, even being able to go into these careers, right, to help build that future workforce. I want to come back on one thing I mentioned before as we think about making those kind of investments. We're saying they need to be multi-year, with a real long-term. We know that what gets measured is what gets done. But measuring impact is of something that is long-term is sometimes one of the most challenging things. So let's talk about measurement. How are you approaching that? How are you building it in? Jay, let's come back to you on that.
Yeah, I think this is such an important point, Catherine, that you can't improve what you don't measure either. And I would say that bold aims create systems, and systems create results. So starting with a bold aim of what the impact is by when, so then you know what change you're trying to advance in a particular issue. And so, we've looked at the issue of output. So these are either short-term, people that have been directly impacted, or individuals trained, and then outcomes, which are long-term results that track for individuals or communities. And we've mentioned some of those earlier. As we think about an overall measurement and evaluation strategy, organizations, we found that can keep these particular areas in mind when selecting metrics. One, strategic alignment, so impacting the prioritized areas. And for us, it's the issues that we're focused on this fiscal year and our theory of change levers that I mentioned earlier, and then the problems that we're solving. So are we making progress on those issues? Feasible. The metrics can be measured with current or planned data and analytics infrastructure that you have. Quantifiable, percent change over a period of time. attributable. So it should be realistic to affect the change in the metric over the next year, and then 3 to 5 years, and evidence-driven. So existing research indicates that a metric, that metric can address the challenge you're looking to move. And I would say that in health equity, we've also got to think about the ROI differently from a long-term view, indirect and direct benefits because of the impact on productivity, retention, recruitment, but also as the demographics are changing in our country, that has an impact as well on what happens with health equity. And so, I would just urge that piece as well. And so we're, looking at directly lives touched, but also looking at how we change some of the outcomes and workforce metrics that align with mental health, maternal health, chronic disease. And what we've also found in our recent alternative sites of care report is that greater than 50% of people of color and people in rural communities are looking at prevention and mental health and other modalities. So to this access point earlier, it's also thinking about metrics in a build-on fashion. So there may be multiple metrics over time that build on each other.
That's great.
Yeah, one of the things that you said, Jay, and I love this term, bold aims. I think we talk about goals sometimes. I like that terminology. I may borrow that. But what we're seeing at United Health Group and probably other large healthcare organizations is really making some long-term commitments. For example, we set out a long-term commitment or a long-term goal last year to close 600 million gaps in care by 2025. In the last year, we've made progress closing about 110 million of those gaps. And then we also have a goal, you mentioned preventive care, of ensuring that 85% of the people that we care for get preventative services by 2030. And we're well on our way on that, 69%. So by setting those goals, and really keeping our folks focused on that, and I love the framework that you went through, that was really helpful. I think that's how we're gonna make progress.
That's great. Well, I know we've got to wrap up this discussion, so I'm going to bring it back to the title of this panel called Better Health for All. As we're listening to this, we're really hearing that advancing towards true health equity is pushing our thinking and requiring a different approach to innovation about, how, when, who has access to care. So I'd like to just wrap up really thinking about how we shift to get towards those approaches and how do we truly achieve better health, better outcomes for all. Let's do this as a bit of a lightning round to get us to the end of this panel. So Jay first.
Yeah, I would say that one, we're at a time where I've seen alignment among the public sector, the private sector, and community-based organizations around health equity in a way that I have not seen it in a long time. And so, how do we take that and build and advance a movement around it and embed health equity in systems? And that requires us to look at our own biases, our own assumptions. And we have this 4 domains of action that we look at organizationally. What are we doing internally? Around our policies, our programs, our data, our tech. How do we put a lens of health equity through our products and services? How do we think about our role in the community? And then the ecosystem is like vendor and supplier diversity or policy, those kind of domains. But we've also generated, I think, through this crisis in COVID, confidence for innovation and trying new things. And the public-private partnership paradigm has shifted as well. So challenging our thinking to look at that differently. But I always come back to starting with the perspective of lived experience. What do people I interact with, my patients, families, community members, community leaders teach me about what is needed? So starting with that obsession of around lived experience and then designing backward. So, if we're doing, for example, food delivery, digital food delivery, it's still difficult to understand how you got to pay for example, if a payer is collaborating with Amazon Prime on food delivery, the payment for that upfront. If it gets delivered to an unsafe neighborhood, it may not get delivered there. So there's all these, logistical other constraints that we can solve for. We've just got to think about it from the perspective of the person, family, community impacted. And I'd say it's imperative we don't lose the momentum from collaboration that we've seen through the pandemic. And we often hear organizations, and I hear this, that the next normal, the new normal. I just want to make the point that normal didn't work for everyone. So even that language ends up impacting the people you're actually trying to care for and improve their lives. So I think that, that's, I just see a lot of, I think, exciting opportunity. Abbott, United Health Group, and all the organizations I represent at the chamber here are just doing incredible work. And I think learning from each other and lifting up those things that work and say, how do we work together on this issue so that we can drive greater impact?
Yeah, Jay, I would definitely agree with that. And when we think about our focus at United Health Group to really advance a modernized health system, we really can't do that without a relentless focus on health equity. And just to your point around collaboration, we have to do this in partnership with organizations that can connect with people in ways that we can't. Yep. I'm encouraged by some of the innovation I'm seeing, particularly a program that United Healthcare started about a year ago called their Catalyst program, where they're going into a community very intentionally, looking at the data, identifying the specific needs of that population in that community, working with local health facilities as well as social service organizations to really understand the health disparities and what that community needs. And I'll give you an example of one in Kansas City, Missouri, where they're really focused on addressing health disparities in maternal health, something we've talked about today. And by partnering with the local federal qualified health center and 2 social service agencies, they've been able to get more mothers into prenatal care. They're carrying their babies to term at a higher rate, higher birth weights for the infants, and a 90% adherence rate to the postpartum appointments that they have, which is really important, where a lot of the complications arise. And I mention this as an example because you mentioned collaboration. I think that's what this conference is all about, Catherine, when you started the question that way about the business and the community coming together to really solve some of the most pressing health challenges of our time.
Thank you so much. And I hope everybody who's been listening here is both encouraged and inspired by some of these fantastic examples and deep commitment that you're sharing from both Deloitte and United Health Group. The themes that we've heard here, I know, are not unique to the healthcare industry. And if you're not from the healthcare industry, you may be sitting here and saying, how does this really apply to us, right? But health, as we started at the beginning, is really that foundation for thriving economies. It's important for your workforce. It's important for you back at home with your family and your loved ones. And in challenging times, we need to make sure these investments continue. But importantly, I think we need to make sure the other things that were mentioned here today continue. That collaboration. No one's going to solve this alone. We are going to need to work across the public and private sector to put the right solutions together. Both of you really talked about the long-term thinking and this long-term commitment, and we have to keep investing in that for long-term solutions. And then finally, this systemic thinking of saying, this is in the spotlight, right, of these last couple of years because of the pandemic, and a lot of people have really thought that has been the biggest healthcare challenge. A lot of what we're talking about today, maternal health, reaching populations that have been historically under-resourced and underrepresented, those existed before the pandemic. And so, better health for all is going to keep requiring all of those things, sustained investment and long-term thinking. Thank you so much, Jay and Tracy. This has been a delight, and I think we can all leave, inspired that there are, these commitments for solutions on the horizon. Thank you both.
Thank you.
Thank you.
Thank you. Thank you.
Okay, we made it, right? This is the last time we're going to join together as one group in this room. Our main stage sessions are over for this conference, but we still have more programming. And this is where I get to give a little bit of stage direction on what we can do. We're going to go to breakout sessions. They're going to start in 15 minutes. They're going to be posted on the screen behind me where they are. I hope that you'll participate in those. And then we're going to come back here around 12:30. You're going to grab lunch, if you'd like, and then we're going to go to the buses for the field trips. So you can leave your stuff in here if you'd like, but the one thing you need to know is after the field trips are over, we're not coming back to the Reagan building. So make sure you have all your stuff, or you're going to be in a cab by yourself coming back here. But thank you. Thank you so much for being with us these last 2 days. We've covered a lot of ground, and we have a lot more to do. And we'll be having programming throughout the course of the year on each of these topics that we talked about throughout 2023, and we hope that you'll join us for those. For those who want to revisit or relook or share what we talked about here at this conference, next week, all the sessions on the main stage will be available on YouTube, on our channel, so please share those with your colleagues. Now we have to thank people. And what I really want to do is make sure that we thank the Chamber Foundation staff, not those that you can see, but the whole team behind the stage that you can't, because they made this possible. So let's give them a big hand. And of course, none of this would have been possible without our sponsors as well. They've been posted in the rooms who they are. So if you see someone from one of those companies, please thank them. Without their financial support, we could never put these events on. So we're really appreciative of their support as well. So give it up for the sponsors. And just please remember what you learned. Right? You know, we're here again to inform, to inspire, to ignite that collaboration for impact. And I think that we've made some good progress, but we've got a long way to go. We really appreciate everyone's help in everything that you do to make the world a better place. So thank you very much, everyone.